And now I'd like to introduce Stephen Daniel, Employee Benefits Consultant for the Mahoney Group.
Well, thank you. It's very nice to be here. We're looking forward to sharing with you some of the reasons why you might want to consider self-funding. Many companies are looking for ways to bring better health plans to their employees. I mean, it's a challenge that has faced our country for some time. We saw a massive shift in what is lovingly known as Obamacare, the Affordable Care Act, that attempted to address some of the challenges that are facing companies countrywide. And so self-funding has been something that's been around for a long time. However, in this particular community, it's not used as prominently as it is in some of the other states. There are some reasons for that. There are some challenges for smaller companies in Nevada in using a self-insured product. So generally speaking, if you are a company that has 50 or less employees enrolled on your health plan, it's not very viable for you right now. If you have 50 or better yet, at least 100 employees on the health plan, then it becomes a much more viable opportunity for you to take advantage. Let me just back up a little bit, though, and explain a couple of key principles that I think you'll want to know. With your fully insured, let me just contrast a little bit fully insured and self-insured. With fully insured, which many are already in, that's your plan with Health Plan of Nevada, there's Anthem, Aetna, United Healthcare, all of those various carriers. If you have their plans, you're called fully insured. The challenge with many companies with fully insured is that, well, you don't know what's going on under the hood, so to speak. And so what happens when you get your renewal, you only have a couple of data points that tell you anything about why your increase was what it was. You contrast that with your other plans, your workman's comp. You know why your workman's comp rate is going up because you know what claims happen. Well, in the fully insured world, in most cases, with a few exceptions, you really have no data, no understanding of what's going on. Well, part of risk management is first identifying the risk. You got to know what's going on. You got to be able to open up the hood of your car a little bit, look into the engine, the components, and see what's happening so you can identify what is wrong. Then you can address it. Well, in appropriate risk management style, you need to then minimize the risk after you've identified it. Ideally, if you can, you want to eliminate whatever risk you can, transfer the risk, and then last but not least, finance the risk. And that's really where the insurance plan comes in. Unfortunately, where most people are with their health plans, the only risk management tool they're using is the finance part. So they're not doing any of the other things that they're doing, but a large reason for that is because you don't know anything. So that brings us to why self-funding. You need some help in controlling your health care costs, more choices in your design plan. You get data, which allows you to provide your team, your management team, intelligent decision making. And then you have on-demand reporting capabilities. We'll talk a little bit more about that. This is 101, so I'm not going to dive too deep. But to give you an idea of what I mean by that, let's say, for example, you have a large percentage of your employees going to the emergency room for routine type things, okay? So their tonsils or their various ailments for allergies, things of that nature. Well, if you had more data, you could see that. And then you look at your copay for the emergency room, and maybe you see your copay is $100. So at $100, there's no reason for them to not go to the emergency room. Well, the emergency room is one of the biggest expense items for those kinds of routine medical needs. It can cost $1,000 to $1,500 to go for allergies in this particular example. So the $100 copay at the emergency room, we would take a look at that and say, well, maybe we need to pop that to $500 so there's more cost share, so that it hurts a little bit more. Now you say, well, I don't want to hurt my employees. Well, we don't want to hurt them. What we want them to do is go to more affordable options. And so we may create a telephone doctor option where they have very small or even no copay to get to a doctor for some of those routine expenses. It's better for them because it's 24/7 access to a doctor. So that's just one example of the kinds of things that, you know, we would do when we look at some of the reporting. Now, here's the situation, okay? Self-funding has been around for a long time. But for a long time, up until the late 80s, it really was more for companies at 1,000 employees or more. But over the last few decades, smaller and smaller employer groups have begun to take on doing things with self-funding, primarily because of the double-digit increases that have been happening in their plan. So as you can see from some of the data on the PowerPoint there, I won't go through every one of those, but the bottom line, though, is more and more companies of smaller sizes are looking at self-funding. And there are some reasons for that. We've actually made self-funding easier. We'll talk really briefly about level funding, but that's self-funding that feels a lot like your fully insured plan, in which you just get a premium in the mail, you submit the premium, but you get some of the benefits of knowing what your claims are, and also any claim dollars that are not used through the year are back to you as a company. And so as we look at, is self-funding the answer, again, as I've shared with you, not in every case. If you're 50 or less, definitely probably need to stay in the fully insured, though in Arizona we have clients, and in other states that are 10 and 15 lives that can do it. But in other states, there is more flexibility than in the state of Nevada with how you can design some of the contract features, and we'll talk briefly about that as well. So fully insured, you really get nothing. You know nothing. And you just get a renewal, very little data, and so it's difficult to do some of the risk management. So in looking at the self-funded components, what we can do is we can break apart what happens in a fully insured plan. So just so you know, your fully insured plan in many ways works like a self-funded plan. Some of the things that are happening in fully insured are what are going to happen in the self-funding. You just now know about it. You just see it happening. Like I said, it becomes transparent to you. Now, some of the things that, again, before we get into breaking apart what is going on in your health plan and in self-funding, here's part of the reason that you want to take a look at this, okay? 20% roughly of the cost of your plan comes from administrative costs, okay? 80% of your plan comes from claims. So if you want to control your premiums in the future, if you want to lessen the impact of premiums in the future, then you've got to control the claims. Now here's what I will say to you. If the only thing you want to do is see what's going on and you want maybe some money back at the end of the year if you don't use all your claims dollars, that by itself is not a good reason to go self-funding. And the reason for that is because if you don't get a little more active and you need a good consultant to help you with this, okay, this is not something you can take on by yourself, you need to be able to take a look at what's going on in those claims and do something about it. And let me just tell you a little bit about the Mahoney Group. We have been in a self-funded product for 8 years. We were running into the exact same problems that everyone else was, increasing costs that we felt completely out of control with, and we have not had to increase our employee costs for 8 years, but we are very active in managing what's going on our claims. We have wellness programs. That by itself is not the fix-all, but we have I've been voted the second most healthy employer in Arizona. This last year, I think we were third, the year before that. So we walk the talk. We know a little bit about what we're talking about for our clients because we actually practice what we preach in our own plan and have seen great results from that. So some of the components, like I said, you're going to have about 20% of your costs is in the administrative costs, and then 80% is in claims. And the reason that's important is because if you have a claim spend that's out of control, that's the part that's going to kill you. However, you can gain so much more value for your employees by taking on self-funding because it allows you greater flexibility. Because the parts of the self-funded plan come in stop loss, claims, and administration. Your administration costs and your stop loss costs, and I'll explain what stop loss is in a second, those are two things that you can shop out separately. And so you can have some control over even the ID cards that go out to your employees. You can have control over the actual insurance component. If you're not happy with the insurance component, you can change that out. You can change out the third-party administrator, which I'll explain in a moment as well. The claims part is the part that you also can have greater control, as I've mentioned before, through various ways of plan design, communication to your employees. Like, for example, we have a diabetes management program. That diabetes management program helps make sure that our diabetic population, which is one of the greatest expenses in many companies throughout the country, are compliant. Because what we have found is we want to make it easier for people to spend money for the kind of medical care that they need, because that helps keep small claims small. We want to keep small claims small, keep them becoming medium-sized claims or large claims. So what is stop loss? Stop loss is the insurance portion underneath the hood. As we spoke earlier, we have three different components. Well, the stop loss is the part that keeps the insurance claims costs from overrunning the company budget. Okay, so let me describe it like this. You have a personal health insurance plan probably, and in that you have a deductible. Your deductible is usually per person in your household. So if you have a $1,000 deductible, and let's just say for our purposes today, we're using a health savings account plan. And a health savings account plan, nothing gets paid by the insurance until you hit your deductible, okay? So your prescription costs, your doctor's office visits. Now bear in mind for a second, and some people say, well, that sounds terrible. Well, think about it like this. All your other insurance plans work that way. Your car insurance doesn't pay you any benefits to rotate your tires or to change your oil. You don't pay a copay for those things. You just simply pay that out of pocket. The insurance only kicks in when it's time for insurance to kick in, when you hit your deductible. So let's say for this purpose, you have a $2,000 deductible and nothing is getting paid until then. That's what an individual stop loss contract does. Except it's a much higher, and it's for the entire company, it's for each employee of the company. And it often will start at around $50,000, though for smaller plans, and some of our plans in other states that allow this by state. That's some of the difference here in Nevada. You can't have a stop loss contract below a certain amount in Nevada, so that makes it more challenging for the smaller companies to do this. But let's just say it's $50,000. So each time an employee hits claims of $50,000, then the stop loss contract kicks in and picks it up from there. Okay, so there would be no more liability to your company at that point. So that's kind of like an individual deductible in your plan. The aggregate is like the family out-of-pocket maximum in your plan, okay? So your family out-of-pocket maximum may be $12,000 to $13,000 these days. That's by law. There's an out-of-pocket maximum that has been created as part of the Affordable Care Act. So that would be like the aggregate. So that would be the total that was paid in from prescriptions, and it could be multiple members of the family. Well, the aggregate stop-loss contract works much the same way. There is a maximum liability that your company would be on the hook for. I'm not going to get into the calculations of that. It's not a 2-person or a 3-person times that. There is a calculation that is used to come up with the aggregate. However, it works much the same way in that there is a point where, let's say you had 100 employees and 50 of them used $5,000 of coverage. Well, at some point, you would want that to max out. Okay, let's say the 51st person comes on. Well, with an aggregate policy, if you had hit your aggregate maximum liability, well, then you would no longer have to pay anything out of the claims fund that you had set aside to pay for claims. So what we're going to talk about next, go ahead and let's rotate a couple more here. So there's a couple of different stop-loss, there's several different stop-loss contracts. Again, it would take a little bit too much time to break all of those down, but the basic rule is claims come in over, let's say, a 12-month period. Okay, that's what you're used to, an annual contract. But you could have what is called a 12-15, which just simply means that claims incurred in 12 months, paid, though, in 15. Because as you may know, let's say you had someone go to the hospital December 31st of this year, and your plan ended 12/31 of this year. Well, do you think that the claim from the doctor is going to come in the very same day and get processed on 12/31? No, it's not. So a 12-15 contract allows for that claim to come in January or February or March and still get paid from the prior year's claims contract, okay? And so that, again, it would take some time to go through all that, but it's important to have the right contract, especially if you're going from a fully insured plan into the self-funded world. So let's talk at this point in time. Let's keep moving on that. I think I covered some of those main points. Let's talk about claims again. Okay, so how do claims work? There's a couple of different ways that it can be designed. Okay, the larger the company, the more likely they are to fund claims as they are incurred and come in. You'd get a claims report that says, okay, this month you had this much for prescriptions and this much for other medical diagnostic services that were rendered by your plan. You are the plan, okay, but you have a third-party administrator that handles all this. So this is not something you do. The third-party administrator that you pay, you hire, they provide the services for taking those claims, taking a look at them. Hey, does this work in our plan? Should this be paid? That's called adjudication. They adjudicate the claim. They make sure that the claim should be paid, and then they apply the appropriate network discount, and then the claim dollars are paid. But once the company puts money in the claims account to pay it. An additional way that smaller companies have been doing self-funding is they do what is called a level-funded contract. In a level-funded contract, it works a little bit differently. You actually fund what is believed to be the claims, the expected, all the way up to your insurance contract maximum. Again, it would take a little bit of time to explain this, but in essence, it can be 125% of expected. So you will get an actuarial number that says, based on your population, based on the health risk, This is what your expected claims are. In a self-funded contract, though, you're going to go ahead and fund all the way to 125% because, in general, that's what your aggregate stop loss is, okay? So you're going to fully fund the claims. So instead of getting the claims report and then funding, you're just going to get a bill every month, and that's how your fully insured plan works. In reality, you're fully funding your fully insured plan. They're doing all these things under the hood of the car, just like what I've described previously. Yet at the end of the year, in a fully insured contract, they keep the difference. But in this scenario, at the end of the year, you get to keep the difference. Okay? So any claims dollars that didn't go out, you get to keep. So that's part of the reason why it's so important to understand what's going on with your claims when you go into this type of role. Have a consultant that you're working with that provides you those services, provides you the reporting, as well as the help to determine, okay, I have this data on the claim spend. What do I do with it? What programs do I need to put in place? For example, we have a program for dialysis. So, you may have a lot of going on in dialysis in your group. Well, we have a program that helps manage those costs. Behavioral health, we have a program that helps manage those costs. So those are all things that we help and come alongside you. So you don't have to redesign the wheel or anything. We've already done it. We help you, as would other consultants that know what they're doing in this particular world. But the TPA is the one that actually pays the claims. They actually help you provide the reporting, and they help you set up the bank account, all those different things that you need to do to make this work. It's actually pretty easy. This kind of can sound overwhelming to people, but it's actually not that challenging because if you have the right partners, most of this is done and presented to you and help you come alongside you put this in place. But you are, in essence, the health plan. And so you pay out the claims, and then at the end of the year, anything that's left over, then you get to keep. The TPA does these things. They're going to do billing, claims administration, COBRA administration, plan document preparation, ID card printing, network access. All of those things are things that the TPA does. What you're going to do when you look at something like this is you're going to do an analysis. And that's part of what, if you decide at some point you want to take a next step, what you're going to want to do is gather the data. There's several things that are needed in order to do a proposal or an analysis of your company and whether or not this is viable for you. Here's the quick lowdown on pros and cons. Pros, you have a lot more control. You have transparency of your claims. You get more of your dollars back. You're going to be able to shop out the various components of the self-funded plan, even the ID cards, the network. All of those things can be shopped out and looked at. Your pharmacy benefit. You don't have to just take one pharmacy benefit management company. You can shop that out. There's a bunch of them out there. We're saving our clients sometimes 20-25% just on the pharmacy spend alone. So those are all things that you can do inside of self-funding. Those are all the positives. The downside, risk. If you have a lot of unhealthy people in your group, it may not be the appropriate time to take it on right away. Now, we already know over 3 to 5 years, and that's the kind of commitment you need to consider before you take this on. Over a 3 to 5 year period, you're going to have some large claims hit. That's why you get a stop-loss contract. That's what that's designed for. It's there for that purpose. We know that. That all by itself, our company has had some large claims over that 8 years. But because of the kind of management we do in our claims, the kinds of stop-loss contracts we get, they're okay with an occasional year where we have some large claims. That by itself doesn't blow up the plan. What can be a challenge, though, is the plan can have some claims that are chronic, ongoing, very, very challenging. Some of the prescriptions, for example, that are out there can cost $25,000 a month. Okay, so for smaller companies, a $25,000 hit, as you can imagine, the following year, and that's an ongoing claim that's not going away, that's going to cause some real challenges inside of your plan. And so those kinds of risks are part of the reason why some companies, based on what's going on in their company, they're not ready to take on self-funding. Again, the larger the company, the easier it gets. As you know from the law of large numbers, there is a predictive modeling inside of groups gets better and better the larger the population, the sample. Okay, so especially once you're at 500 lives, that number becomes infinitely more credible. However, again, very successful companies have done it as low as 50 lives. And so it is feasible, it is viable for companies of less than 500 or 1,000 as was in the past. The cost of self-funded is basically broken down in fixed costs and claims costs. So in summary here, that's really what it boils down to. You're going to pay about 20% of fixed costs and then 80% of claims. Let me just finish by saying it's very exciting for you and your company to take a look at something like this because it actually brings greater health care opportunities to your company. And I'll finish with this. One of the things that we're really excited about is we have a rating system. It is a report card, so to speak, of facilities, surgical centers, hospitals, in which we can say to you, per diagnosis, if they are an A, B, C, D, or F. Now, that doesn't mean the facility is A, B, C, D, or F. That's not what it means. What it means is that facility is really good at that diagnostic code. They may be really good at knee surgery, for example. Or they are a C rated. That very same facility could be a C in knee surgery, but A in stents. So what this report does is it actually helps you to see where's the best place to go. I mean, doesn't everyone want to go to the A-rated facilities for their heart situation, right? Even their knee. What does that mean for the company? Well, it also means that person is going to get the best possible care, potentially get to work back faster, their recovery time is quicker, and guess what? If you move one person from a C-rated facility that they were going to an A-rated facility, it actually saves the plan money. It actually saves the plan to get better quality care. The average savings is $16,600 for a person to go to an A-rated versus a C-rated facility. So those are the kinds of things that we're bringing to the table in the world of self-funding that makes it exciting. It allows us to provide a better quality care component to your employees. It means that they're happier, they're feeling that the company's come alongside of them, and those are some of the reasons. Again, an analysis needs to be done to make sure it's a right fit for you, and I encourage you to do that. Is there, at this point in time, if there's any questions, be happy to answer.
Absolutely, and again, if you don't have a question now and you think of one later, I just want to remind everyone that you can always reach out to the chamber and we can get you in touch with Stephen and the Mahoney Group, and he'd be more than happy to answer any of your questions. So I know we've run out of time, but I just want to thank you so much again for joining us today. Thank you, Stephen, for presenting. And,
you bet.
And remember, this webinar will be available for review on our YouTube channel, and I hope that you guys go and check that out. So thank you and have a lovely day.